Hello, and a warm welcome to members, staff, and stakeholders that have tuned in this evening. My name is Jim Potter, Chairman of the Northern Care Alliance NHS Group, which brings together hospitals and community and health services for Salford, Bury, Rochdale, and Oldham. We'll put an agenda up on the screen at some point in the next few minutes so members can see the running order tonight. Thank you for joining us for our annual members meeting 2020. This was a year in which the NHS has been at the forefront of the public's mind for many months. And I'd like to firstly thank all those who have kindly donated their time in volunteering, donating and supporting our staff at the Northern Care Alliance. It has been greatly appreciated. This evening we have our usual agenda, which includes a series of films made up for this evening's event. I'll begin in the usual way and confirm that we've received no formal apologies. We have been joined this evening by both executives of the Trust Board and non-executive directors, as well as governors, a member of the Governing Council. The draft minutes of the previous meeting, which was held on the 14th of October 2019, have been made available in advance of this meeting on our website with a request for comments. I can confirm that we've not received any comments at this time, other than to confirm that the draft minutes are a true record. And on that basis, I'll sign them off as such and accept that they've been approved. And finally, I'd like to formally announce the result of the governor elections that concluded just 2 days ago on the 12th of October for our Salford governors. I can confirm that Mrs. Chris Mullen and Mr. Jim Collins were re-elected, along with Mrs. Anne Garvin Daly, to represent Salford Public Constituency, and Mrs. Hilary Richardson was elected to represent Salford Health and Social Care class. And Tammy Pike was elected unopposed to represent Salford Corporate and General Services. Congratulations to you all, and thank you to those governors who have stood down at this time. It's now time to show you a series of short films packed full of images from throughout the year, and we hope that this is informative and interesting, as it always is. Thank you. Right, 2019-20 was another extremely challenging year for the Northern Care Alliance and for the NHS as a whole, both financially and operationally. This was intensified towards the end of the year with the onset of the COVID-19 global pandemic. The Northern Care Alliance mobilised a swift response, which you'll hear about more from our Chief Executive later on. I'd like to take this opportunity to thank our staff and volunteers that continue to carry out incredible work to help provide the best possible care for all our patients and their families at this time. Our Council of Governors has discharged its responsibilities throughout the year, with 3 meetings held during 2019-2020. You'll hear more about this and the work of the Council of Governors from the lead governor, Chris Mullen, a little later in the meeting. We had a number of governor changes during 2019-2020, welcoming new public governors and appointed governors as highlighted. I would like to formally thank all governors who stepped down from their role during the year. Following the appointment of 2 new non-executive directors by the Council of Governors, Mrs. Carmen Drinkwater and Mr. Tim Crowley, they joined the Board of Directors, bringing with them expertise in organisational development and financial strategy, respectively. In addition, the Council of Governors also reappointed myself as Chairman for a further 1 year. My term of office will conclude following this meeting, marking the end of over 15 years serving the people of Salford and beyond. The Salford Annual Report and Accounts 2019-2020 presents a fair and balanced picture of the year and is available to download from the Salford Royal website. The report highlights significant developments to services and improvements to care and outcomes which have occurred throughout the year, along with our key challenges. Raj will present the highlights from the report and a look forward to our plan during 2020-2021 later in this meeting. I'm pleased to confirm that Salford Royal received an unqualified audit opinion, confirming that the financial statements provide a true and fair view of the financial position of the group, charity and the trust as of 31st of March 2020. Despite a challenging year, Salford Royal's financial position for 2019-2020 was a £51,000 surplus. And so, I will now hand over to the League Governor, Chris Mullen, who will present the work of the Council of Governors, followed by Chief Executive Mr. Raj Jain in his first year as Chief Executive of Salford Royal and the Northern Care Alliance.
Hello everyone and welcome to the annual members meeting today. My name is Chris Mullen. I am the League Governor for the Northern Care Alliance. I am pleased to have this opportunity to share with you the work of the governors for the past year. As governors, we have a number of statutory responsibilities and duties. We are not involved in the operational running of the trust. However, governors do have a key responsibility to hold non-executive directors to account for the performance of the board. Governors perform this duty in a number of different ways. We attend and observe the monthly board meetings called the Committees in Common to keep ourselves up to date. We are also involved directly in determining and receiving the outcome of the annual appraisal process for both the chairman and the non-executive directors. We engage regularly with the non-executive directors and the executive directors, where we seek and receive assurances from them with respect to the performances of the Northern Care Alliance. We also have 4 meetings each year in the local organisations of Bury, Rochdale, Oldham and Salford. And it is at these meetings that we discuss these particular sites in more detail. As part of these meetings, we always review the NCA membership. And this year we chose to concentrate on recruiting the younger members of our local communities between the ages of 14 and 21. We also focused on trying to increase our male members and our veteran membership, which were slightly underrepresented and have now improved. An important role for governors is engaging with our members and our local communities, and it is something that we really enjoy doing. We do this in a variety of ways throughout the year, including, for example, attending local health and wellbeing events, where we take the opportunity to speak and listen to members of the public about the experience of care, which we then feed back to the Trust. Since March, the Council of Governors have been kept up to speed about matters and developments in response to the COVID-19 via weekly bulletins and more recently via live virtual meetings. Our chairman, Jim Potter, has briefed governors after each meeting of the board, and we held our first virtual Council of Governors meeting in June. Unfortunately, as part of stringent infection and control measures in place, public governors have refrained from visiting hospital and community sites to engage with visitors and members in our usual way. However, I know that we all have continued to listen to our neighbours, friends and family members, and in some cases attend online forums such as myself, which is my local GP forum, and we feed back all these comments to the organisation. You will soon hear from the Chief Executive regarding the progress of the legal acquisition by Salford Royal NHS Foundation Trust of the Bury, Rochdale and Oldham elements of the Pennine-Acute NHS Trust. As part of these arrangements, governors have recently had discussions on the membership structure and composition of the Council of Governors that will come into effect on the date of the transaction. Following much healthy debate, Council of Governors approved a revised membership structure and composition with representation from public, staff and partner organisations across the whole of the Northern Care Alliance footprint. We will be providing members with further update in the coming months. Our Governors' meetings are open to the public. These will be held online until it is safe to meet in person again. Please do check the membership area of the Salford website for meeting dates, details and previous papers. Lastly, I would just like to say, on behalf of all the governors, a huge thank you and farewell to Jim Potter, who has been our fantastic chairman for over 10 years. Jim has steered us through many changes and challenges, none more so than the last 6 months. Your support, Jim, and friendship has been fantastic, and you'll be sadly missed. So, on behalf of all the governors, thank you and enjoy a well-deserved retirement. Your feedback is always welcome to the Trust and the governors. If you wish to contact us, you can either email or call us as shown on the slide below. Next, you will hear from the Chief Executive, Mr. Raj J, and thank you for listening.
Good evening, everyone. Thank you for joining us for the Annual Members Meeting 2020. My name is Raj Jain, the Group Chief Executive of Salford Royal NHS Foundation Trust and the Northern Care Alliance NHS Group, which includes the hospitals and community services of Pennine-Acute Trust. I am pleased to present and give you the opportunity to hear about our services and developments for the last year across the NCA. While we are taking the opportunity to hold our annual members meeting in a different way this year due to the current situation, we are hoping it will be no less informative for our members, who include patients, the local community and our staff. We have also taken steps to ensure that you can still interact with us and ask the questions that you may have. I'm pleased to start my update by telling you about the progress we are making on our quality improvement journey, which has the ultimate goal of saving and improving more lives. During the last year, we launched our first NCA group-wide quality and productivity improvement strategy. Patient safety and our focus on harm reduction continues to be the organisation's priority. It is the cornerstone of everything we do. We are proud of this commitment. We were pleased that throughout 2019-20, Salford Royal maintained its hospital standardised mortality rate within the top performing 10% of organisations in England, and was statistically lower than expected over the last 12 months, whilst Pennine-Acute improved its rating to within as expected. Healthcare mortality is complex, but monitoring our risk-adjusted mortality rate is one way to understand how we are progressing in eliminating preventable deaths. I am delighted to say that 2019-20 saw Pennine-Acute's Care Quality Commission overall rating improve from requires improvement to good. This was a magnificent achievement for our staff, who have worked so incredibly over the past 3 years under NCA to improve standards of care for our patients and service users. Services within Pennine-Acute Trust are now providing safer, more reliable, higher standards of care than ever before. Of the service areas inspected across the CQC domains, 90% are good or outstanding. The CQC report highlighted lots of exemplar practices across all our services. Fairfield General Hospital and the Trust's end-of-life care service was rated at outstanding. The Royal Oldham Hospital was also rated outstanding for end-of-life care, improved the rating for critical care and surgery, and maintained good rating for urgent and emergency service, despite increased demand. Rochdale Infirmary retained good and was praised for outstanding practice for their Oasis unit, home and a day team, and the clinical assessment unit in its previous assessment. The CQC also recognised the Kindness Collaborative as an area of outstanding practice. We look forward to our teams continuing their improvement journeys and are proud of all the progress they have made so far.
Over the last year, the SWAN model of end-of-life and bereavement care has and continues to be fundamental in the support and care of our patients and their loved ones. This has promoted dignity, respect and compassion at end of life. It has further enabled collaborative working between bereavement, specialist palliative care teams, mortuary and chaplaincy services. This has ultimately contributed towards the outstanding CQC rating which was achieved in February for palliative end-of-life care and bereavement across the North East sector hospitals of the Northern Care Alliance. It was evident to the inspection team that the SWAN model was fully embedded within all clinical departments, with staff taking full ownership. Excellent practices within end-of-life care were clearly demonstrated across all these areas. During the peak of the pandemic, this has prompted health professionals to think outside the box in applying the SWAN model of care. This has been achieved in lots of innovative ways. This has included introduction of the signet role, which has ensured patients do not die alone in the absence of their loved ones being able to visit. Obviously, some aspects have been out of our control. However, these extra acts of care, kindness and compassion from all clinical teams has significantly contributed to our patients and their loved ones' experiences, albeit the situation.
Our nursing teams continue to strive towards the highest standards in nursing. We monitor these standards via our nursing assessment and accreditation system called the NAS, which is our framework for ensuring that patients receive safe, clean and personal care every time. We call this SCAPE. The NAS started life at Salford Royal over 10 years ago and in recent years has been rolled out to all other hospitals within our group. We know it is still held up as the benchmark to work towards and create a great sense of pride and ownership amongst our nurses and the colleagues they work with. By the end of 2019, 35 of our Salford Royal's 43 wards had achieved the SCAPE accreditation, along with 11 of our community healthcare teams. At our other hospitals, where of course the NAS is much newer, wards there are making fantastic progress in working through the numerous assessments. By the end of 2019, 5 wards held this status.
On T5, as a team, we are proud of the outcomes we have achieved within the NAS assessment to date and feel that we have demonstrated our commitment with a proven track record for excellent individualised patient care. We believe that all our patients receive safe, clean and personal care every time, and achieving SCAPE status has allowed us to continue to share learning and grow as a centre of excellence.
From an operational perspective, the year commenced with a continued increase in demand for our acute services, challenging our ability to achieve national access standards for much of the year. The NCA was unable to achieve the 95% national standard for treating patients within 4 hours in the emergency department. However, each of our care organisations and hospital sites ranked amongst the top performing organisations in Greater Manchester for emergency department performance. Due to a mismatch in capacity and demand, we were unable to achieve the 92% national standard for the numbers of patients waiting less than 18 weeks for referral to treatment. Work continues with partners in Salford, the North East sector and Greater Manchester on ways we can deliver better, more timely care to our patients. We continue to rise to the challenges of staff absence due to sickness, including influenza and work-related stress and anxiety. by enacting our NCA Staff Health and Wellbeing Strategy. This was launched with initiatives including introduction and training of mental health first aiders, signing the Times to Change pledge as a commitment to support staff with mental health difficulties and to reduce the stigma associated with mental health, recruiting 250 mental health champions to support our colleagues, the Employee Assistance Programme, which is a 24-hour advice and telephone counselling service, the pilot of a new kindness collaborative at our Oldham Care organisation, which was launched in August 2019 to increase civility amongst staff and make organisations a kinder place to work. This project talks to the importance of kindness in relation to performance improvement and specifically in healthcare, a reduction in patient harm and mortality. In July 2019, we welcomed some 1,300 staff to our organisation from Pennine Care NHS Foundation Trust, who work in teams across a range of community healthcare services in Bury, Rochdale and Oldham. Across each locality, we now provide acute and community health services, a key step in delivering our vision for integrated place-based care. We also launched our Anchor Institution and Social Value Programme, working to strengthen our role as an inclusive employer within our localities and ensuring that we are able to support our communities into employment and training. Retention of our people is a key factor in ensuring we have the right skills to deliver our services, and we made significant progress this year. Nursing vacancy rates across Pennine Acute have reduced from over 20% 3 years ago to 8% in 2019. In Salford Care Organisation, nursing vacancy rates have reduced from 7% to 1%. We have also reduced our dependency on the use of expensive locum agency staff, which creates more stable teams across our services and continuity of care for our patients. Within the year, we approved and committed to a 5-year plan to improve workforce equality, inclusion and engagement across the NCA and improve the working lives of our staff. We are one of the first NHS organisations in the country to make such a commitment to equality, where diversity is valued and the experience of our staff is at the forefront of what we do. The NCA was included in the top 25 of the UK Inclusive Employers Top 50 list. We have established our new Inclusion Centre of Excellence, utilising our position as the 24th most inclusive employer in the UK, and have been commissioned by several organisations to support their progress around inclusion. Meeting the needs of those who require our services and improving their health outcomes, whether in our hospitals or in the community, is a core aspect of our values. The experience and standard of our care our patients and service users should expect should be a positive one. The summer of 2019, our patient and service user experience team introduced our NCA plan to deliver patient-centred care, treatment and support. We co-produced this plan over 12 months by listening to feedback on what matters most to our service users and staff. Themes established included young people having their healthcare explained directly to them, as well as their parents. Recommendations for improvement were based on these findings, and we are now rolling out this experience-based design to the rest of the organisation.
During COVID, the Rochdale Infirmary has been a beacon of success in surgery and innovation. We, in the breast service, have been able to provide cancer surgery for all our breast cancer patients. Not only this, we have innovated and introduced a new technique of mattress localization of sentinel lymph node, and we are one of the few centers in the country doing this. This has not only improved the quality of care that we provide to the patient, but the quality of service that we provide at the trust and regionally and nationally.
Towards the end of 2019-20, the NCA, like all other NHS organisations, was called upon to respond to one of the greatest challenges ever presented to the NHS, the COVID-19 pandemic. We continue to be extraordinarily proud of the way our organisation and our teams have responded, with courage, commitment, compassion and professionalism in treating and caring for those with the virus and in preventing the spread. Our planning and preparation started well in advance, and we continue to adapt to ensure we can deliver the best possible care and treatment to our patients and service users during these challenging times, ensuring that the safety of our staff and patients remains paramount. Across the NCA, we have successfully discharged over 1,200 patients who were diagnosed with COVID-19. To pay tribute to our staff, they have been truly amazing, working through the most uncertain and daunting of times to display the highest levels of care. Some of our colleagues have had to carry out different roles or work in different areas. Many clinical teams have had to wear full PPE for their shifts. Some have had to shield. Many have had to adapt to working remotely and from their own homes. And a significant number of our teams have had to quickly embrace new digital technology, for example, to offer online outpatient appointments or assessments. No matter what their role, we know all of our staff have had to work differently during the last 6 months, and many continue to do so. We are proud of our involvement and joint working with other organisations in many aspects of our response to the coronavirus. In the early phase of the pandemic, we worked with Manchester Fashion Institute business development team in developing PPE, including medical scrubs and gowns in bulk, developed at speed by Manchester Metropolitan University. A team from Salford Royal also helped design and make thousands of protective visors for colleagues working on the front line. And in April, Fairfield General Hospital was the first hospital to open the important research study to compare and treat the first 6 patients in the UK on the effectiveness of 3 new pioneering ventilation methods for COVID-19, including CPAP machine manufactured by a F1 giant, Mercedes-AMG, as part of the National Recovery RS trial.
Hello, my name is Jane Nisbet and I'm one of the critical care consultants working across the Northern Care Alliance. Through the pandemic, I've been based at Fairfield General Hospital. I've been asked today to talk to you about one of the studies we're undertaking within critical care, together with colleagues from across respiratory medicine. This trial is called the Recovery Respiratory Support Trial and is one of the National Institute of Healthcare Research priority studies being undertaken within the UK. I'd like to start by saying thank you to all the patients and their families who've agreed to take part in this important research to try and find an effective intervention to avoid the need for invasive ventilation in severe COVID disease. I think it's important for us to recognise that it's only through research that we now understand there is an effective treatment for severe COVID disease, that treatment being dexamethasone. Within the Recovery RS trial, there are 3 arms of care that a patient may be randomised to. The first arm being the standard care arm, which involves up to 15 litres of oxygen being delivered via a non-rebreathe mask and asking the patient to lie on their tummy. Another arm is the application of continuous positive airway pressure via a tight-fitting face mask. And the final arm is to receive high-flow oxygen via nasal cannulae. From the outset of the pandemic, it was apparent to us as a multidisciplinary team that putting research at the centre of what we do would lead to better outcomes for our patients, not just those within research, but those in the whole footprint. It's only through a sustained multidisciplinary team effort that we are now the highest recruiter to this study within the UK. and it has led to also to the development of the acute respiratory care unit, in which I now work together with colleagues from respiratory medicine, physiotherapy, and most importantly, the nursing staff. It is only through research that we will find effective treatments and interventions to save more lives from COVID.
The NCA has recruited the third highest number of research participants to urgent public health COVID studies in England, just over 3,000. These are the studies that the Department of Health and Social Care has made the highest priority. It is difficult to call out specific teams or colleagues because as an organisation, everyone, no matter what their role or level, has pulled together as one. Quite simply, everyone has been exceptional. But to give a few examples, our colleagues in the Panda unit at Salford Royal, which treats children and babies, they had the superb idea of adapting their visors with popular film and cartoon characters to make their masks they were wearing feel less scary for our young patients. During the time where we had significant restriction on visitors, our nursing colleague, Leona Harris, who is based at Fairfield General Hospital, fundraised tirelessly to provide iPads for patients to stay in contact with their relatives. Our staff have been truly tremendous, and it's important for us to keep on letting them know what a great job they're doing and how valued they are. This includes their families too, as we didn't and we still don't underestimate the significant impact that the pandemic has had on our staff members and their loved ones. You may have spotted the hashtag NCA Family Campaign, which included a suite of thank you letters from myself as Chief Executive to our staff members, children and young relatives. We even enlisted the help of footballer David Beckham to help launch the campaign, which we know has had a great response from our staff and their families.
Hi everyone, I just wanted to send best wishes and thanks to the NHS Northern Care Alliance family. You're all doing an amazing job, and I just wanted to send a special shout out to all the kids whose mums, dads and wider families are working so hard across hospitals and communities in Greater Manchester during this time. Carry on supporting each other, stay safe, stay well, and lots of love. David.
I'm sure our staff would say they've been helped enormously by the support they've received from the community, particularly in the early months of pandemic. This included letters of thanks, pictures, cards, messages of support and encouragement on social media, and donations of food, drink, equipment and many more supplies to keep our staff members and their spirits up. We appreciated every single gesture. Thank you. Sadly, we have lost 4 members of our NCA family to the virus. The loss of our colleagues has understandably had a significant impact on our organisation, and particularly those who knew and worked with them. Our thoughts are with their families and friends. They will always be remembered. Of course, COVID-19 has not gone away, and we are continuing to work very hard to keep infection rates down and keep our hospitals safe for our staff and patients. It means we've had to introduce robust measures across our hospitals, which of course feel unusual to our patients and service users, but must be done to ensure we keep everyone safe. This includes asking people to wear face masks on our hospital sites and to use different entrances and exits to our buildings so we can help maintain social distancing. It remains as important as ever that we only have patients on our site if they really need to be here. This makes our ongoing work to keep our A&Es only for people with serious or life-threatening injuries or symptoms even more important. While we keep on adapting and responding to the national and local situation in our ongoing management of COVID-19, keeping the safety and the welfare of our patients and staff at the forefront of our plans and decisions. We will also continue to play an important part in encouraging our patients and wider communities to follow all infection control guidance in the hope that we can keep as many people free from this virus as possible. I am going to leave the last words on my COVID-19 update to Betsy, the daughter of Tammy Sutcliffe, one of our staff members. Betsy is one of the young stars of our It's in Our Hands campaign, and she has some extremely wise words for us all. Thank you, Betsy.
Hi, my name is Betsy and I am 7 years old. My mummy Tammy works at Royal Oldham Hospital as Directorate Manager for Trauma and Vascular. My mummy had COVID in April and was in hospital for 6 days. And I was very worried about her. My mummy is back at work now, but COVID is still very real. So I want people to follow rules. I have 3 key messages. Please keep washing your hands, keep social distancing 2 meters apart from each other, keep wearing your mask. Let's help keep everyone safe. It's in our hands.
As part of our estate strategy, we advanced plans to bring 2 major developments to patients from across Greater Manchester. In Salford, we gained planning permission for the Acute Receiving Centre, which we call the ARC. We achieved this in December 2019. This was a significant milestone for us in bringing this new facility to Salford and the wider Greater Manchester population. The ARC will allow us to deliver 21st century care in respect of major trauma and high risk and emergency surgery. Salford Royal is already the lead provider for major trauma in Greater Manchester, and the ARC allows us to enhance our facilities, including 72 new beds, 5 new theatres, new imaging facilities and a new helipad. With the ARC, Salford Royal will be the hub site for complex general surgery across Bolton, Salford and Wigan.
So right from the outset, the clinical teams have been really closely involved in the design of this building. We've worked really closely with the architects, so it's entirely purpose-built for our patients. So for example, we start with a specially designed trauma reception area with scanners and x-ray facilities. We've then got specially designed lifts that can accommodate not just the patient but all the equipment they need and a full trauma team, so that we can easily transfer them to the operating theatres or the critical care unit, which are all very close by. And talking about the operating theatres, we've got 5 new operating theatres, but what's really exciting is we're going to have the UK's first hybrid theatre that's designed specifically to treat patients with multiple injuries. So we'll be able to do specialist interventional radiology procedures to stop the bleeding, for example, from their liver or spleen or their internal organs, and also do surgery for other injuries they might sustain, for example, a head injury. And then also on the roof is a helipad, which will allow really rapid access to all these facilities for patients that are the most seriously injured. Also in Oldham, we held public events last autumn to showcase our plans for a major extension at our Royal Oldham Hospital site. These plans have now been given planning permission. This will allow us to offer 2 new 24-bedded general surgery wards, as well as bringing brand new emergency theatres. The new facility will allow the Royal Oldham to operate as the hub site for high risk and emergency general and colorectal surgery for the North East area of Greater Manchester. We are of course delighted to be playing such a key role in improving the provision of specialist care to the population of Greater Manchester and beyond. With local authority planning permission for both schemes already granted, we look forward to starting building work on both developments during 2020-21. During 2019-20, we committed to working with Hitachi to deliver a digital control centre for the NCA.
Discharge Insights is a solution that gives us an overview of patients' estimated discharge dates and helps us track discharge-related activities. With this solution, we will be able to coordinate our tasks better and reduce time patients spend in acute settings unnecessarily, getting them home or to the next stage of their care quicker. Being able to coordinate our discharge tasks better is just one way our organisation can deliver safe and high quality care in times of a global health crisis. There are many other components of the Digital Control Centre.
The Digital Control Centre will help us deliver outstanding care and prevent harm through smart technologies, the power of information, and our staff's mindset to continuously improve our ways of working. It will support us to better predict and plan so that we can avoid those situations that we know can lead to extra worry and inconvenience for both our staff and patients. It is a 10-year programme with the vision and potential being proven at Salford Royal, but the programme is designed to be able to be spread to other sites and to support our community services. Our partnership with Hitachi is pioneering, and we hope that the wider NHS can learn from what we're doing here in the NCA.
We really hope you found the presentations interesting. Of course, if you have any questions as a result of the content you've seen tonight, please do direct these questions to our membership team at foundation@srft.nhs.uk, and they will be in touch. In recent weeks, we've received a number of questions from our members in advance of this meeting, and I would like to share with you now the answers. Thank you.
Hello, my name is Chris Brooks. I'm a consultant in A&E. I'm also Executive Medical Director for the Northern Care Alliance. And we've received a question from a public member, Pamela, asking us for assurance regarding the quality of care provided at Salford Royal. As many of you will know, Salford Royal has been rated outstanding by the Care Quality Commission on 2 consecutive occasions, most recently in 2018, and has also been designated by Newsweek in the top 100 global hospitals in 2019 and 2020. It has been recognised by NHS England as performing admirably in the recent COVID pandemic, and has a proud record of working beyond boundaries into our communities. Regarding outpatients, our approach is consistent with our Home First policy, and yet where there is a requirement for patients to be assessed in person, this is of course always available. I hope Pamela finds that reply helpful. Thank you.
Hello, my name's Simon Featherstone. I'm the Director of Nursing at Salford Royal Hospital, and I received a question from Suzanne, who said that my father has had a temporary loss of memory and often finds it difficult to remember things, especially in a strange environment. He had to visit outpatients recently for an appointment, and I was not allowed to accompany him. Could there be an exception system put in place for a relative of someone vulnerable, either physically and or mentally, to request and arrange to accompany their relative? Suzanne, thank you for your question, and firstly can I apologise for the problems you've had in terms of being able to visit with your father. You'll be aware that the ability to visit inpatients or to accompany loved ones to hospital appointments has been severely affected by the COVID situation, and hospitals have been forced to make some really difficult decisions around this. None of us want to restrict patients receiving visitors or limit the ability for patients attending outpatient appointments to bring people with them. We recognise the emotional and physical support that this can bring. However, we've had to be guided by both national and local guidance around the issue, not least around the local community prevalence of the COVID virus. That being said, we worked with colleagues both locally and nationally, and we recognise that there are certain patient groups who would benefit from having a relative or loved one accompany them to their outpatient appointments or whilst they're an inpatient in the hospital. This includes those patients with a disability, which means they will benefit from having someone with them to support them whilst they're here. Our visiting guidance has been amended to reflect this and to make sure that people like your father get the support they need when they visit Salford Royal. So thanks again for your question, Suzanne. We have acted upon it with colleagues nationally. We've amended our visitor guidance to enable you to visit with your dad in the future. Thank you.
Hello, my name is Donna McLaughlin and I'm the Director of Social Value Creation for the Northern Care Alliance. I received a question from the public member Chris. He asked us, will the Northern Care Alliance recognise the value of all staff, whoever their employer may be, by building on its aspiration to become a living wage employer, by ensuring that every person working within the NCA is paid at least the real living wage? Firstly, Chris, thank you for your question. I want to assure you that the NCA are committed to being a living wage employer. We are tied into national terms and conditions to Agenda for Change. The current nationally negotiated pay scale has taken some staff below the hourly living wage. A new pay deal is anticipated in 2021, and we ask partners to join us to lobby for nationally negotiated pay to be linked to the living wage for a sustainable solution. If we were to resolve this locally, there will be significant local cost. However, if this is not resolved by 2021 pay deal, we are working across Greater Manchester to have a GM solution to avoid organisations pitching one against the other. We are also committed to bringing services back into the NHS which have previously been tendered out to ensure that all of the NHS terms and conditions, including sick pay, annual leave, occupational health and wellbeing services, are available. For example, security staff across the North East sector have been brought back in-house. I hope this answers your question, Chris.
Clark, Chief of People for the Northern Care Alliance. We had a question from Liz, a staff member, who wanted to know about home working arrangements for administrative staff, particularly secretaries and medical PAs. Since the COVID outbreak, we've had a policy in place of home first wherever possible for office-based staff, encouraging people, if they were able to work from home. That policy is still in place, so we are in line with the most recent government guidance. We do recognise, however, that it's not always been possible for everyone to work at home. Sometimes the needs of the service have meant that we have needed administrative staff in to support the clinical teams, and that's meant that not everybody from the team could work from home all at the same time. In addition, we know we've had technology and equipment challenges. We've got more equipment on order, and it is our hope through a programme of work we have underway that we can embed this sort of flexible working more permanently as a feature of working at the NCA. I hope that answers your question, Liz.
Hi, my name's Ian Mostyn and I'm the Group CFO for the Northern Care Alliance. I've been asked a question by Patricia, who's one of the local members. Patricia's question asks back to the announcement made by the Chancellor earlier this year around writing off of debt for NHS organisations at this challenging time, whether the debt has been written off and whether it's made a difference to the NCA. Patricia, thank you. It's a really interesting question. The write-off that the Chancellor was talking about back at the start of the pandemic related to a specific type of debt. It was the debt that we're carrying for operating trading deficits. So that's debt that we've incurred where we've needed cash loans to cover the fact that at times income hasn't covered the cost that we've got and there's been a cash shortfall. The way that the Chancellor was proposing to write the debts off was to convert those loans into something called public dividend capital. Public dividend capital is broadly equivalent to the department taking an equity stake into NHS organisations and sits on top of existing public dividend capital that we all organisations already have. I can confirm that for Salford there's been no write-off of that type of debt because we aren't carrying any of it. For Pennine, however, there has been a significant benefit. We've seen £161 million worth of loan written off and converted to public dividend capital. It doesn't mean, however, that either Pennine or Salford is now debt-free. Both are still carrying some small numbers of loans that relate to previous investment in capital. They relate primarily to two things, in part to some buildings and also to energy efficient schemes that are providing us with ways of lowering cost into the future. Hopefully that gives a reasonable indication of the impact for both organisations and tries to give some wider explanation. Thank you very much for an interesting question.
This month we say farewell to our chairman Jim Potter and our group chief nurse Elaine Inglesby Burke, who are both retiring from the NHS. We are truly indebted to both of them for their significant contribution and their many years of service to the NHS and in particular to Salford Royal and to the NCA. Both Jim and Elaine have been at the cornerstone in the success and achievements of Salford Royal and more recently at Pennine Acute, helping drive forward and lead the improvements for the organisation. Their names and their contribution will always be remembered and synonymous with the achievements and the history of Salford Royal and the creation of the NCA group, where they have always led by example and put the interests of patients first. We wish them all the very best on their retirement. Thank you.
Thank you to everybody involved in the presentations. As usual, I feel really humbled to be the chairman at times like this when I see the depth and quality of the people that are involved with the Northern Care Alliance. It truly is a fabulous organisation. It brings us almost to the end of the presentation this evening and also to my time as chairman. It's been an absolute pleasure to be part of this innovative and caring organisation as chairman since 2006 and as a non-executive director since 1999. It's really gone by very quickly and the organisation has just gone from strength to strength in recent years, and I'm immensely proud of the role that I've played in it. I wish everyone involved in the Northern Care Alliance, the public, patients, staff and partners, all the best for the future, and I hope to see you all next year in person as part of the audience probably. And I'll now hand over to Raj for a final comment before I close the meeting.
Thanks, Jim. Just two things from me. Firstly, just to thank the team that's put together this annual members meeting under such difficult circumstances. You've done a great job. Thanks to Rebecca, Jane and the comms teams in particular. But Jim, the reason why I wanted to have some time at the end of this meeting was to thank you for your contribution, your magnificent leadership of this organisation over nearly 2 decades. But I'm going to spare your blushes, well, for now, because we'll have an event a bit later and they'll come out then. But what I wanted to do was to make an announcement that I think goes some way to recognising that contribution that you've made to the people, the patients, the staff of Salford and Greater Manchester over so many years. And we wanted that recognition to be a lasting recognition that you and your family can see for a long time. And that is that we want to tell you that we're going to make an announcement that the ARC, the Acute Receiving Centre as it's currently called, will be renamed in your honour and it will be called the James Potter Building. Your name will be displayed on that state-of-the-art lovely building that you can see on the screen forever and more. And that goes a small way to recognising the contribution that you've made to our organisation, driving it to a world-class organisation. And just thank you, Jim.
Thank you. I'm not sure I can say much. I'm a bit choked up now. Thank you, Raj, and thank you, everybody. It's been an absolute delight and a pleasure. Thank you. Good evening, everyone, and stay safe. Bye for now.